it was 1993, I met this young cardiologist who was in fellowship training to be an interventionalist, and he came up to me after the banquet and he said, "Hi, I'm Ahmed Sabe." He became very actively involved at the national level at the Society of Chest Pain Centers. And we made a very strong argument that we needed to move the care of the patient to the front door, not upstairs. And we had this discussion because cardiology at the time thought this had to happen in the CCU. 2001, 2002, we sent out across the country that we will begin accrediting chest pain centers for the first time in the history of the United States. Very soon after, my phone rings and it says, "Hey Tony, this is Ahmed Sabe. Do you think Canton Mercy Medical Center could go through this?" And I said, "Yeah, you know what you're doing and you're doing it right, and I know you're doing it right." And these concepts that we knew would work if we could just try them became a reality right here in Canton. Every 43 seconds, someone in America is having a heart attack. Every 43 seconds, half of them are dying before they get to the emergency department. And of those who do reach the emergency department in the better hospitals, 1% mortality. We have defeated heart attack in America, almost like polio, if you get here with a pulse and a blood pressure. Out of hospital cardiac arrest, people going back home, 5% at the very best hospitals in the country today, usually less than 1%. And here, Dr. Sabe and the team at Mercy Medical Center has 15 experiences. 8 of these people lived. That's stunning.
He got home from work. We shoveled the walk and came in to sit down, play some Nintendo, and I went out in the kitchen to make tea and come back and he was out.
I think I was out shoveling snow right before my heart attack. I came in and sat down, was playing a game of Nintendo. That's when the lights went out.
He was not a living human being at the time we got our hands on him. They can't admit a dead person to CCU or to ICU. And at the point that we started working with him, he was dead. He had no spontaneous heart rhythm. He wasn't breathing on his own. It was all the support of the CPR and having the breathing tube down his throat. Having our emergency room cath lab right there, he wasn't admitted. We took him and we did what we could to try to bring him back to life. And we looked at his arteries and found that they were completely blocked. Once we got him on bypass, Dr. Sabe could do his part and open the arteries and try to restore the blood flow.
Very few people that came in full cardiac arrest walk out. To see somebody come in that condition, to leave walking, I think that's just incredible.
This was Dr. Sabe's work in reviving him and the patient and his wife's work in regaining his thinking skills.
I was here every day and, started to realize that this was one of a kind thing, that if he had went to another hospital, he probably wouldn't be here today. He wouldn't be here today.
My husband Brian was at work and he collapsed. He has never had any kind of medical issue. He was fine. I had talked to him 10 minutes before he actually collapsed. They shocked him a total of 8 times. And 8 of those times was right in front of me. And it was a very scary thing to see. I mean, he's 34 years old. We came to Mercy, and I thank God every day that we did. All the nurses, the doctors, they made not only him be comfortable, but they also made myself and the rest of the family feel at peace. Dr. Sabe came to us and said today was not his day. That gave myself and my family a sense of peace that I can never thank you enough, because it made us feel he's gonna make it. Mercy Medical Center is a great hospital. I thank God that he was taken here. This heart cath that Dr. Sabe and everybody else brought into this emergency room here is a great thing. It should go to every single emergency room. He did not have a heartbeat for almost an hour. My husband, 34 years old, is sitting right there. He shouldn't be here right now.
There's still more miracles to perform. So thank goodness Mercy Medical is in our backyard.